Hi everybody and welcome to video number 7. I cannot believe that I have made that many videos. You may notice that I am sporting some new headgear. It is all about the hair this week. This was a gift from a very close friend of mine who was my chemo buddy on Friday. I have them in 3 colours and they are fabulous because they are made of cotton, so they are really quite cool. I'm suffering with a lot of hot flushes at the moment, so these are quite easy to wear around the house particularly, and when I go to sleep, which of course I'm going to talk more about hair in a later video, but it's quite handy to have a hat in bed. With cold capping, so you may have noticed that I am using a cold cap, you can only, or you're advised only to wash your hair once a week. So like a week like this, we've had storms all over the place, so my hair has been battered. So by the time we get towards the end of the week, it is nice to be able to put something over it and just cover it up. These hats are just fab. Today's subject is all about the appointments that you will have following breast surgery. So the first appointment is 2 weeks in, and that's with your surgeon. You will be greeted by your surgeon and your breast cancer nurse, and you will be told basically what they found when they did your operation, and is it confirming what they thought they'd found in the biopsy. So here I was told that they had removed the lump, they had removed that margin that we were talking about in an earlier video, and there was no signs of any cancer cells in the margin, but the lump was a little bit bigger than we thought. So it went from 14 millimetres to 22 millimetres. They also told me that they'd removed 19 lymph nodes and there was cancer in one lymph node, the sentinel node. There was quite a lot of cancer in that sentinel node. So that would mean that chemotherapy was definitely going to be required. Spoke to me then in that room about trials that were happening at that time. And there was a trial that my criteria fitted because I was low risk. If you decided to go into the trial, they would take your name and then put you in one of 2 groups. The one group was about, you would have the chemotherapy and the radiotherapy, and the other group was just having radiotherapy. And they would just see, you know, what the chances are of it returning. At that stage, my hat goes off to people that do go into these trials, because I think you're very brave and I admire you, but I could not do that. I just wanted to have guaranteed that, you threw everything at it and I was going to just have all the treatment I could possibly get. That meeting finished, and then I left there to go with the breast cancer nurse to be given more information, I suppose, and just to double check how I was feeling and if I'd got any questions. So she gave me this book, Understanding Your Pathology Results, and we went through this book page by page and just confirmed everything that we knew. So I had a little log that I could remember some further books. So because of the situation, it was going to be chemotherapy, so I had a little book about chemotherapy. I had one about radiotherapy, and I also had one about tamoxifen, which is the hormone therapy. She gave me an envelope with vouchers in it. There were some free therapies that you could have at Breast Cancer Haven, which is a local support group, which is nationwide. And that can be all sorts of things, from acupuncture to reflexology to mindfulness, and just depending on your circumstances, they would prescribe 10 hours of free therapy. So she gave me that. She also gave me a voucher to go and get a wig, and encouraged me to do that sooner rather than later, and also where to go. So there's a couple of different places locally that would give me a free wig. So it was all really sort of some preparation for the next day. I left there knowing that I was going to get an oncologist appointment in about 4 to 6 weeks, but I had no idea when that was. And I found this very frustrating. Being self-employed, not knowing when to book my work in, I just wanted to know what was happening, when I was going to start the chemo, how was that going to affect work. So I would probably say that these 4 to 6 weeks that I then encountered were probably the most stressful that I've experienced. and I could actually feel, I felt stressed and very tense during that time. I kept in touch with the breast cancer nurses, and probably found out first from them before I got the letter that when the oncologist was going to be. And that was absolutely dead on 4 weeks from the time I saw the surgeon. That's a wrap for today. We'll talk next time about what happened at the oncologist appointment. So that'll be the next video number 8. And then we'll go on to a number of videos really around preparing for chemotherapy. And I suppose that's another moment in time where some of my coaching experience came in to help me. So we'll talk about that over the coming weeks. Thanks for watching, and I'll see you next week.